Hi guys, how are you today? Welcome to my first YouTube channel and my first video. A little bit about myself. I am an international dentist who is pursuing dentistry and also it gives tuitions to students who for INBD exam. So the first video that I'm uploading today is about cyst, and let's go ahead and discuss a little bit more about cyst. Now, what is a cyst? If you ask me, a cyst is an epithelial lined cavity that is filled with fluid, and the cysts are classified as non-odontogenic cyst, and the pseudocyst. If you ask me what does the word non-odontogenic or odontogenic means, odontogenic means related to the tooth and non-odontogenic means not related to the tooth. It is related to soft tissue. And we all know the word pseudo means fake, so these are the cysts that are not lined by epithelium. They might be lined by vascular lining or a connective tissue lining. So let's go ahead and discuss today non-odontogenic cyst. And under the non-odontogenic cyst, we will be discussing the nasolabial cyst, nasopalatine cyst, median palatal cyst, thyroglossal duct cyst, brachial cleft cyst, and the dermoid cyst. And the first one we will be discussing is the nasolabial cyst. So the word naso means nose and the labial means on the labial side. The other name that the nasolabial cyst goes by is the nasoalveolar cyst as well. Again, it is a developmental cyst, however, the pathogenesis is not certain. I already mentioned that we are discussing non-odontogenic cysts. So these are soft tissue cysts. So therefore, it is not likely to be seen on a radiograph. Again, it is observed as a swelling in the upper lip lateral to the midline, resulting in elevation of the ala of the nose. If you could see the diagram, we can clearly see that it is present lateral to the midline and the ala of the nose is actually elevated. The treatment is complete surgical excision or enucleation. Recurrence rate is rare. The next one we will be talking about is the nasopalatine duct cyst or the incisive canal cyst. Um, Actually, questions do come on this topic in the exam, so pay a little bit more attention here, guys. The word naso means again nose, and the palatine means in the palate. Incisive canal is basically present between the maxillary and incisor teeth, and so the nasopalatine duct cyst looks like clinically as a swelling on the interior part of the palate, and it is the most common non-odontogenic cyst. The most common clinical presentation is swelling in the interior palate, which is accompanied by pain and drainage. So it can be symptomatic or asymptomatic, means the patient won't feel any pain, and if it is symptomatic, there may be pain and drainage association. Again, if the cyst grows too much in size, it can cause divergence of the root of the maxillary incisor teeth. Root resorption is rare, although radiographically it may appear as a heart-shaped or an inverted pear shape. The associated teeth are vital though, and treatment is enucleation. If you could see it on the radiograph, the diagram is clearly, the color diagram, you can clearly see it is present between the central incisor teeth, and on a radiograph, again beautifully, you can see that it looks like a heart-shaped or an inverted pear-shaped. The next one we will be talking about is the median palatal cyst. Many pathologists believe that median palatal cysts are a more posterior presentation of the incisive canal cyst. So let's go ahead and discuss a little bit about it. It presents as a fluctuant swelling posterior to the palatine papilla on the midline of the hard palate. It is often asymptomatic. Again, it appears as well circumscribed radiolucency. Treatment is surgical removal and recurrence is rare. Let's talk a little bit about thyroglossal duct cyst. Before going ahead, I want to talk about the difference between the thyroglossal duct cyst and the brachial cleft cyst. The main difference is that the thyroglossal duct cyst is present on the midline of the neck, whereas a brachial cleft cyst is present on the lateral side of the neck. The thyroglossal duct cysts are the most common developmental cyst in the neck, and residual epithelial elements along the thyroglossal duct cyst that do not atrophy may give rise to cysts commonly found in the midline of the neck. Clinically present as asymptomatic, fluctuant, movable swelling unless secondary infected. Treatment is surgical excision, and more precisely, if I have to talk, the procedure is known as cyst trunk procedure. It's not that somebody's going to ask this in the exam, but just for general knowledge. In the diagram, you guys can clearly see that there is a swelling in the midline of the neck. The next one I'm going to talk about is the brachial cleft cyst. Again, before going ahead, I want to differentiate between the thyroglossal duct cyst and the brachial cleft cyst. Again, it's the location. Thyroglossal duct cyst is present in the midline of the neck, whereas brachial cleft cyst is present on the lateral side of the neck. So brachial cleft cyst arises from the remnants of the brachial arches and more commonly from the second arch. Treatment is surgical excision. If you see it on the diagram, there is a diagram that clearly shows a swelling on the lateral part of the neck. The last one we will be discussing is the dermoid cyst. Dermoid cyst is again a cyst that is lined by epidermis-like epithelium and consists of the dermoid structures such as sebaceous gland, hair follicles, or the sweat gland. Again, it is considered a simple cystic form of teratoma. What is teratoma? It is a tissue composed of more than one germ layer or sometimes all the three germ layers, and those are ectoderm, mesoderm, and endoderm. It is commonly found in the midline of the floor of the mouth as painless, slow-growing swelling that is soft and due to palpitation. Treatment is surgical excision. In the diagram, there is clear-cut swelling in the floor of the mouth. So this was all for today, guys. We discussed the cyst and the non-odontogenic cyst. I will be coming shortly up with a new video with the odontogenic cyst and the pseudocyst. If you like my video today, please subscribe to my channel. And if you have any questions, please comment in the comment section. And if you wish to follow me, you can also follow me on Instagram under the name Inbdetutor, where I keep on posting some practice questions. So I hope this was helpful to you guys. Have a good day. Best of luck. Bye bye.